Okay. Good afternoon, everyone. Welcome to Cooking for Reducing Disease Risk, focusing on high blood pressure today. My name is Amy Rosenfeld, and I'm the Community Outreach Program Manager at Northern Westchester Hospital. I have invited a guest in the kitchen with me today. Have with me Dr. Alan Cofino. He is our Chairman of Medicine at Northern Westchester Hospital and a nephrologist at Northwell Health Physician Partners at Nephrology at Yorktown Heights. Welcome, Dr. Cofino. Thank you so much for being in the kitchen with me today.
Thank you for having me.
So today, if you've joined with me before in the kitchen for this series, we'll be discussing cooking to reducing your disease risk, today focusing on hypertension or high blood pressure. Dr. Cofino will help us to understand the connection between blood pressure, what blood pressure is, and the connection between blood pressure and kidney health to take it to the next level. And I will help us understand the connection between the dietary recommendations of the American Heart Association and other organizations called the DASH diet to help reduce our risk for and control our blood pressure. Just a couple of things before we get started. As usual, if you've joined me before or if this is your first time, please feel free to put the questions in the chat. We'll be monitoring them live and get to as many questions as we possibly can, either during the program or after. If your question's not answered, please feel free to put your question in the survey that will pop up immediately at the end following the program. It's very, very short, 4 questions, and we really appreciate you filling that out. If at any time during the presentation you're interested in a referral or anything for your personal health needs, I also encourage you to put it in the survey at the end. So without further ado, we'll get started. Dr. Cofino, I have a few questions for you today. To start, can you explain what blood pressure is?
Yes, first, I'm very happy to be here, especially talking about hypertension. All right, you ever go to a party and see those blow-up balloons, the long balloons? Think of those balloons as your blood vessel and the air inside as your blood. The air, or your blood, applies a pressure to the inside of the vessel. It's a force against an area in the blood vessel. That is a blood pressure, okay? And what we're going to do today is relate high blood pressure or hypertension to many diseases, including kidney disease. And this is going to be followed by talking about how to prevent it, how to reverse it, and how to cook for it.
Awesome. That's a really good visual explanation, actually, like a really, really good explanation. Can you explain blood pressure numbers? Like when I go to the doctor's office and they say I have 120/80, what exactly does that mean and what should I be striving for?
Okay, so the heart pumps, it squeezes and it relaxes. Systole, diastole, systole, diastole. When the heart pumps, it forces blood out into the blood vessels. The pressure measured at that point is called the systolic blood pressure. That's that top number. When the heart relaxes and you measure a blood pressure, that's called the diastolic blood pressure. So 120/80, the reason we pick those numbers are those are the perfect numbers. If you go back to the 90s, we called the normal systolic pressure anything under 160. But what we've come to realize over the years is that as systolic pressures go up, you increase your risk of many things, which we're going to talk about today, including kidney disease. So we're striving for numbers under 120 and under 80.
And is that a change of recent that the numbers should be under 120 and 80? I know, for a long time, doctors were saying 120/80, that's perfect.
Well,
when was it changed to be less than that?
Actually, 120/80 is pretty perfect. Okay. But the real change has happened over the last few years as more and more studies have come out that demonstrate that as you go up from that blood pressure, other risks come into play, and we'll talk about them.
Okay. And maybe you can explain some terminology that people might have heard before, or heard their doctor mention. What's the difference between prehypertension and then different types of hypertension, such as primary hypertension or secondary hypertension?
Okay. So prehypertension is that area that we don't yet diagnose as hypertension. When that top number runs anywhere between 120 and 129, these people are at risk for developing higher blood pressure. And so we call that prehypertension. By labeling it and teaching people that, they know it's time to start getting on board and reversing it. When that number hits 130, we call it hypertension. And that bottom number above 85, we call hypertension. And that's when we recommend, it's recommended to us that we start treating it.
Okay. And is there a difference between primary and secondary hypertension?
So secondary hypertension, which turns out to be the minority of people, secondary hypertension is when there is something else causing the hypertension. In some cases, this is reversible. So an example might be sleep apnea. For those of you that know people who sleep on these machines to help oxygenate at nights, when you put them on machines, their blood pressures go down. Hypothyroidism can do it. Renal failure can do it. Sometimes you develop, sometimes your body makes abnormal amounts of certain hormones that can raise your blood pressure. Sometimes a malignancy can do it. So these are things that are all potentially treatable. And when we go in and we treat them, sometimes we can reverse the high blood pressure.
Okay, this is so interesting. What would you say the risk factors are for developing hypertension?
Risk factors are actually pretty straightforward. And there's something that you should get on top of taking care of right now, even if you're not a hypertensive. Obesity, sedentary lifestyle, a poor diet, the diet heart and salt. What's that cutoff for sodium? 2.3 grams a day. Right? Average American eats 3.4 and above, up to 6 and 7 grams a day. And just a note, the minute you turn over the salt shaker, you go over your limit. A high sodium diet, high cholesterol. High cholesterol causes plaques in blood vessels. They make them stiff. And when blood vessels are stiff, the pressure goes up. Diabetes, smoking, and understand, so far, everything I've talked about is reversible. Now, genetics, we find there's some genetic predisposition. Age, as people get older, their blood pressures go up, and lastly, race. And these are things that you really can't correct.
Mm-hmm. I see some questions coming through the chat about culinary recommendations. We're going to get to those. So just want everyone to be aware. I will definitely get to those later in the program. What about the connection between hypertension? You mentioned heart health, but what about the connection between hypertension and kidney health? What's the connection there?
I love the connection because in some ways it's really the wrong question to ask, and I'll tell you why. Okay, right. As blood pressure goes up, and we're going to talk about this in a little while, it affects everything. But with respect to the kidneys, it can cause kidney failure. So in this country, we have over 500,000 people on dialysis. And you know what dialysis is. I'm sure everybody there is familiar with it in some way. And around 130, 140,000 of those people are on dialysis because of high blood pressure. On the flip side, when the kidneys get damaged, they can raise your blood pressure. Okay? So you want good blood pressure to protect your kidneys, and you want good kidneys to protect your blood pressure. So it goes both ways.
And in general, in terms of like the scale of things, the prevalence of kidney disease, say compared to heart disease or other chronic disease risk, where would you say it falls in line there? How common is it? How prevalent?
So it turns out that 15%, estimated 15% of Americans have chronic kidney disease.
Wow.
9 out of 10 of them don't even know it. And that is according to the Center for Disease Control in 2021. It's huge.
Yeah, and that's been increasing over the years?
It is
that number?
It is increasing over the years. Just to put it in some perspective, I'll get back to that in a little while.
Okay. All right. So how does controlling our blood pressure help to reduce our risk for kidney disease? Maybe you can explain that a little more.
Right. Think about what high blood pressure does is it damages vessels. When you talk about heart, what you're really talking about is cardiovascular disease. Now, vascular are your blood vessels. And where do your blood vessels go? Everywhere. There's no organ in your body that is not fed by your blood vessels. If you damage the blood vessels, you damage the organs. Okay? And so one of the issues, with high blood pressure is that high blood pressure damages the vessels and increases your risk for atherosclerosis, the development of these plaques in all blood vessels in your body, including the kidney. And so high blood pressure causes kidney damage for that reason. But also think of this, if your pressure is high, there's your kidney, then the pressure into the kidney is higher. And the kidney's being damaged because it's also dealing with a high pressure front coming into it.
Okay, that's such a good explanation. What other potential health complications, you mentioned heart disease before, but what other complications are associated with uncontrolled blood pressure or hypertension?
This is great. Let's start at the top. Stroke, dementia. So it turns out there's actually some evidence that people who have high blood pressure have biomarkers for Alzheimer's disease. So Alzheimer's might actually be an outcome from that. Let's go down a step, the eyes, blindness. Let's go to the heart, atherosclerosis, actually the whole body, atrial fibrillation, heart attack, heart failure, aneurysms. So that balloon I blew up, right? If it pops a little area, it actually can open up and develop what's called an aneurysm. You used to see this in the old air tires, how something would pop out of an air tire. When the pressure is too high, they pop. When your pressure is too high, these aneurysms or outbursts, these little openings in your blood vessels, they pop. Let's go down, kidney failure. And I've already told you that over 500,000 people are on dialysis, and 15% of this country, adults, have CKD. Nerve damage, so the blood vessels that feed the nerves, peripheral neuropathy, damages to the hand, damages to the feet, damages to your sense of feeling. One of my favorite things to talk about in the office, which seems to affect men more than women, I don't know, sexual dysfunction, okay? Very commonly, you can have sexual dysfunction from poorly controlled high blood pressure. And these are only a few of the items.
And it's really like in some ways, the root of so many of the chronic, it is the root of so many of the chronic health issues in this country. There's a question that came through that said, can you reverse hypertension if you have CAD or coronary artery disease?
Well, it turns out—
Are we going to get to that later?
Yeah, no, it turns out that when we start talking about diet, there are actually studies out there that show that you can decrease your blood pressure by lifestyle modifications. And I want to cite something right now, okay? This is a lot of this information is all in a pamphlet called Blood Pressure Counts, all right? It was written by, this is an Eagle Scout project. And if you go to this Facebook site, the pamphlet, which has had so far, well, up until now, it is everything I've said in it is at that site. So you can look at it, okay? And anybody that wants it, we can send them the PDF file.
Yes, we can certainly do that after the program. That's great to have it all in one place.
So yes,
and I know
this is reversible.
Yes. Okay. So we'll get to that question when we talk about lifestyle modifications. So Dr. Grafino, what are the signs and symptoms of hypertension? I know this is a tricky question.
It's the $1 million question. So a study came out when I was training, which right now is ancient, many years ago, that looked at people with systolic blood pressures over 170, and they found that only 5% of them had symptoms. Headache, some dizziness, sometimes lightheadedness, but headache was the big one, waking up with a morning headache. Recent studies have suggested that a greater percentage of people feel their hypertension, their high blood pressure. But here's the problem. So the normal blood pressure is 120. Let's say that you start feeling your blood pressure when you get to 160, 170, or 180. You spent all those years in that other really dangerous range, damaging your other organs. And that's what you don't want to do, which is why you need to follow your blood pressures.
So let me ask you this.
Oh, I'm sorry, one more thing. And that's why they call it, that's why they call hypertension, high blood pressure, the silent killer. All right.
Yeah. Let me ask you this. A patient goes to the doctor's office and they're nervous, right? And, they call it white coat syndrome. Every time they go, they have high blood pressure. They take it immediately when you get into the office, right? And it's always slightly elevated. And, the patient says, I'm nervous, right? What's your recommendation to get like a true value of hypertension? When should they be checking your blood pressure? How do you overcome the white coat syndrome?
Right. Some people just never do. So I had a patient a few years ago who came to me because every time they added a blood pressure medication to her regimen, she'd get dizzy. And I put one of these automatic cuffs on her and I sent her home and I watched her blood pressure drop 170, 160, 150, 130, under 100. And so I wrote her a note telling her to fire me. And she said, "You're fired." So she was fixed. White coat hypertension. It's tough. I usually wait and I retake blood pressures in my office. But for those people that for everybody that comes to my office with a problem with hypertension, I recommend that they get a good blood pressure cuff, a good blood pressure machine for the arm, not the wrist. And I ask that they take their blood pressures a couple of times a day at home. And that's the way we screen out the white coat hypertension.
And if you're younger and you don't necessarily have an established history with hypertension, would you recommend advocating for yourself to get a blood pressure checked at the end of your appointment, maybe after the anxiety and the nervousness goes down? What would be your recommendation for the younger population?
Always, for everybody. If you're high at the beginning, check it at the end. We always do anyway. And a lot of physicians do, but absolutely.
Okay.
Absolutely.
To be your own health advocate is always a very important thing I like to bring up in these programs.
Necessary, very necessary.
What lifestyle modifications do you recommend to patients to help reduce their risk for developing hypertension or reducing high blood pressure if they have it?
All right. First thing is I learned quite a few years ago, after spending a lot of time in the literature, that a diet that helps control high blood pressure, I've used in my office. I've taken patients off of blood pressure medications, diabetic medications, cholesterol medications, is a plant-based whole grain diet. All right. There are a lot of great references out there for it, but I lead with that. And the second thing I do, if they're not interested in doing that, we talk about the DASH diet. We talk about the Mediterranean diet. I put them all on exercise programs. Exercise dilates your blood vessel. Dilating blood vessels lowers blood pressure. And those are really the two big areas I focus on. I have them cut back on drinking. I have them stop smoking, because these are all very, very damaging things to your blood vessels. And we've been very successful. Right? And just to note, for those that are interested in trying plant-based whole grain diets, I don't take away medications until I start seeing changes. Okay. So
and we're going to talk about that all today. We're going to talk about all of that, a plant-forward, plant-based diet. I think it's great. And I might be so bold, you yourself follow one, right?
I followed one for a little over 5 years. My sister got me into it. My sister, Lori. It's affected my family. They all eat more vegetables. They're all in better health now. Oh, absolutely, I do. And in the process of this, during this talk, we'll talk about some of the books to read and references to look at. Okay.
Yeah, that'd be excellent. There are some questions coming through asking, how does a doctor determine if your organs have been damaged by hypertension? And can you fix the damage once it's already been done?
Okay, so can you fix the damage? Well, one of the problems is you can go and you can get a cardiac stress test and it'll be perfectly normal, but that doesn't mean you don't have some coronary artery disease. This gentleman, Caldwell Esselstyn, did this great study where he looked at heart disease in people that have symptomatic heart disease, okay? And what he found based on the plant-based diets, he went in and did angiograms, took pictures, went out 5 years, and he went back again, and he found that he was actually able to reverse the heart disease.
Wow.
And so that's one of the really big arguments for changing it. How do you know that you have any organ damage? Unfortunately, many times you don't. Our markers for kidney disease miss a lot of the early stuff. Our markers for heart disease sometimes miss some of the early stuff. So whether you have it or not, now is the time to start making a difference. Does that answer the question?
It does. It does. And it's definitely motivating. All right. So I guess you kind of answered this question, but you would say what you eat, the foods you choose to eat have a major influence on affecting your risk for hypertension? Would you say it's the greatest thing that helps to reduce your risk?
I think it is one of the greatest. And let me just tell you, the day before yesterday, there was a news report, local radio stations and television, that talked about how every major hospital downtown, this was led by NYU, how every major hospital downtown is starting a plant-based whole grain program to treat chronic disease. So I'm not alone here. I'm not.
Definitely not.
I mean, people are really buying into it. And personally, I think that with activity is the single greatest thing you can do in your life for your health.
Well, I think that's a really good transition into talking about nutrition. And certainly I'm going to present a little bit, but I'd love for this to be a conversation that you and I can have, and because you're so passionate about it, I have so much to give as I'm presenting. Let's do this together, okay? Because I think you have a lot of answers you can give. So I want to talk a little bit today about taking some of what Dr. Cofino said to put it into an actionable plan. For those of you who've been in the kitchen with me before, you know this series is all about taking the conversation to a practical place. Like, how can we apply this to our daily lives into the kitchen? So we're going to talk about the main recommendation that's been research backed for years to reduce your risk or prevent or reverse hypertension, and that's the DASH diet. Explaining the connection between the two, and Dr. Cofino, I think you can really help expand on that. And then some cooking the DASH ways. I'm going to demo a couple of recipes for us. All right, so the DASH diet, which is what Dr. Cofino was saying he recommends to patients as a good place to start. It is what we would like to call, and I'll say it stands for Dietary Approaches to Stop Hypertension, hence DASH. It is a plant-forward style of eating. So Dr. Cofino, would you say that's kind of a plant-forward is making vegetables and plant-based foods the central focus, but you still eat some animal products? Would you say that's meeting people where they are, like somewhere in the middle, to recommend to your patients?
I find with many people that is a great first step, and it is successful. Yes, definitely.
So you don't have to go all or nothing. You don't have to be fully plant-based or vegan to see the effects. You see the effects with just plant-forward.
Now, what I'll tell you is that the studies were all done. The studies that I'm talking about were done with pure plant-based whole grain diets. But what I find in the office is even some of the small changes we make to the diet, using the DASH diet, being plant-forward, has lowered blood pressures, okay?
Okay, great. So that's really motivational for people who might be saying, oh my God, I can't be completely vegan. That's very overwhelming. Plant-forward is what we've talked about here in this series before, and it's definitely encompassed in the DASH diet. The DASH diet is very well established. It's over 20 years ago, it was developed by researchers, and it's supported by the National Institute of Health. So how exactly does the DASH diet work? I'm showing you the servings and the actual plan of what the DASH diet is. Now, I say this with a preface as a registered dietitian. I never recommend people counting calories or weighing food or measuring things out, because it's just not realistic here. I'm giving you these exact serving sizes as a general concept for perspective, and I'm going to show you how to put it into play when you're preparing meals. So for the average person, this is the recommended amount of food and the proportions of each category. So you can see that vegetables and fruits are the most abundant thing you should be including in your diet. If you're totaling them together, it's 10 servings per day, more maybe heavily on the vegetable side. So that is the majority of the volume of your food that you should be consuming on this plan. It also, as Dr. Cofino said a very large inclusion of whole grains. Dr. Cofino, whole grains are not bad for you, are they? Are they
No.
Something that patients should shy away from, the carb phase?
No, absolutely not. Absolutely not. They're great.
Exactly. So a true whole grain, and we're going to talk about what those are definitely included in here. No reason to be carbophobic on this plan. as well as, if you know this is not a true vegan diet, incorporation of low-fat dairy. In small servings, emphasis on yogurt, kefir, and milks, low-fat milks, or plant-based milks, which we're going to talk about. If you're going to include meat in your diet from animal products, it would be more from fish, poultry, and eggs versus red meats. Pork would be included in red meats there. Oils from plant sources, so including healthy vegetable oils, olive oils, avocado oils, things from plant sources. We're going to talk about that. And then, of course, incorporation of nuts, seeds, and legumes a few times, several times per week, if not every day. So the connection here as to why it's effective, the research is showing that it's effective because it is a plant-forward diet where it's so rich in nutrients, particularly minerals of potassium, calcium, and magnesium are what are shown to be really effective in lowering your blood pressure. It's a very high fiber diet from all of the plant sources, the fruits, vegetables, whole grains, nuts, seeds, and legumes. It is low in sodium, as Dr. Cofino talked about before, and the lower you get, the better. Research is showing that if you go as low as 1,500 milligrams a day, which is less than a teaspoon of salt, you see even better effects, as well as being low in saturated fat from animal products and sugar. And it's a real emphasis on portion sizes, balance for foods. And I like it because it really lets it be your own, to allow it to have cultural personalization, that we don't have to make it so it's only eating certain groups. You can represent your culture and your heritage and still participate on this diet very, very well. So essentially the main focus of it here is to reframe your perspective, to think about protein as a side dish, to think not the main event. A lot of the American diet, Dr. Cofino, would you say, is focused on what's my protein going to be? Do Americans get enough protein? Do we need to worry so much about protein?
Well, we're obsessed with protein. All
Exactly.
available to you in a healthy diet.
Exactly. So it's an emphasis on eating an abundance of fruits and vegetables. It is falling into the Mediterranean style of meal planning, for sure, with a little bit more emphasis on getting adequate grains and adequate calcium-rich sources. So when we talk about fruits and vegetables, we're talking about them as your focus. They shouldn't be this afterthought that we throw onto the plate, say as like a, maybe I'll throw some raw carrots in, or I'll throw some salad in. If you enjoy it that way, great. But you want it to be something that's the majority of your plate, filling up 2/3 of your plate. If only half, that works too, but full. So you want it to be what you pay your attention to, what's going to taste the best. Make an effort to incorporate vegetables into all of your dishes, your green dishes, your smoothies, your eggs, your casseroles, even your baking can incorporate more servings of vegetable. And make an effort to prepare delicious types, that it can be roasted vegetables, marinated vegetables, sauteed, caramelized, air fried, baked, pureed, braised. Get creative, get excited about vegetables. And even if you haven't tried a vegetable one way, or if you have tried a vegetable one way and you hate it, you might love it another way. I always give the example that my son hates Brussels sprouts unless they're roasted. And then I have to stop him from getting a stomachache. He eats them by the bowl. He loves them. So there might be lots of different ways to try vegetables you haven't tried before, and then you really, really love them. Any suggestions there, Dr. Cofino, about getting your patients to eat more vegetables?
I just, they should be the majority of your meal.
Yeah.
And I'll tell you, once you get used to eating them, you crave them.
Yes, exactly. You feel the difference your body gets from when you eat them from when you don't. I agree. And then you want to talk about whole grains and dairy here. You want to mix grains back into your diet. There's a lot of emphasis here in fad dieting. I won't say specific fad diets, but those that will not be named that really emphasize carbophobia. And grains are one of the most important things you can include for meal satisfaction, for fiber, for energy, for reducing sugar cravings. for protecting colorectal health, which we're actually going to talk about next month in this series, all about colorectal health, and reducing your risk for everything Dr. Cofino talked about, high cholesterol, atherosclerosis. So please don't be fearful or shy of eating grains. You definitely want to think about portion control, right? Dr. Cofino, we talk about, especially when we talk about kidney health, we want to make sure we're maintaining our blood sugar there. So would you agree that a quarter of your plate for whole grains is appropriate for most of your patients that you would recommend?
And that is what the leaders in the field say. Yes, absolutely.
So try mixing your grains into your soups, your meat dishes, say like a stuffed pepper recipe or a whole grain bean burrito, for example. I've even tried making multi-grain risotto for my family with quinoa and brown rice. You could make a homemade fried rice with lots of vegetables and edamame. You can make dishes, any dish you want, and just put it on a bed of steamed grains, and it would be delicious. Oatmeal doesn't have to be hot. You could have cold oats in the morning. That was actually my breakfast this morning with some seeds and some fruit. You could put oatmeal into your smoothies to get some more grain in. And actually, wheat germ, oat bran are particularly high in magnesium. Those are great things to mix into your baking, your oatmeal, to substitute breadcrumbs or mix in with your breadcrumbs in anything you're doing, and have servings of daily dairy. Okay. This could be a bowl of yogurt in the morning. This could be as yogurt as a snack, or mixing yogurt into your dips, a substitute for fat and baking. As a marinade, yogurt is a great marinade for chicken. And like I said, any breakfast bowls, mixing in with your cold oats. Kefir milk, if you've never had it before, it's basically like a liquid yogurt, really high source of probiotics as well. And that could be something that you have as a liquid for your smoothies, and it's a really great thing to get an extra boost of dairy, as well as plant-based milks. Dr. Cofino, would you say that it's more about the calcium from the research you're reading versus it being a dairy milk? So basically my question is the research as effective on the DASH diet if, say, somebody was having a calcium fortified oat milk versus a glass of cow's milk? Yes.
That's what the data suggests. Absolutely.
Okay. So it could be alternating between. It does not have to be fully dairy, as well as other sources of calcium. Today, we're going to prepare a recipe with dark leafy greens with a Swiss chard, which is rich in calcium. That's another way to get a calcium source, as well as almonds. Tofu are also rich calcium sources. And that's what you want, is to maintain calcium sources for the DASH diet. Nuts, seeds, and legumes, you want to really replace meats a few times a week with plant-based diets. Beans, lentils, soups and stews, chili, homemade falafel, especially baked falafel, veggie burgers, even lentil meatballs. These are all really great ideas that you can substitute meat dishes, or even just reduce the amount of meat in your dishes. In November, I did a program in this series for diabetes, and I showed you how to prepare a pasta sauce with just less meat and more mushrooms. So you can even just reduce the amount of meat in your recipes as well. And mixing beans, lentils, peas as the starch as part of your meal, mixing in with the grains to form the quarter of your plate, is also a really good way to boost your intake of legumes. It's all that really good soluble fiber in there. It's going to help remove the cholesterol from your body, and reduce your risk of heart disease, which subsequently, as Dr. Cofino said before, helps to protect our kidneys and other vital organs. So we really want to make sure you're doing that, as well as reducing the amount of fat that you're having from the animal products. Nuts and seeds into your mixing into your rice dishes, your grain dishes, on top of your salads, your yogurt, into your baking, or just putting some peanut butter on some toast as a meal is a really great way to boost your amount of nuts and seeds. And as I said before, for protein and fats, you really want to pick fish, poultry, and eggs as your main choices. You want to focus on it being the smallest thing on your plate as Dr. Cofino said, we all are getting plenty of protein. So if your protein fits into the palm of your hand, you're doing just fine. That's plenty, plenty, plenty of protein. And focus on healthy preparation, roasting, grilling, sauteing, braising, air frying. I am on the air fryer craze. I think it's excellent. It's a great way to get that crunch you might be missing from fried food, and preparing things in a quick way. I love my air fryer. Slow or pressure cooking, and using plant-based oils. So things to limit here. You really want to limit your sugar and your salt intake. Dr. Cofino, I put here alcohol, 1 drink per day for women and 2 drinks for men. Would you agree with that?
That's the current recommendation. But I'll tell you, when I have 1 drink at night, I feel it the next day. And so I just keep that in mind when it comes to alcohol.
Okay. And when we say alcohol too, we're talking about 6 ounces of wine, 1 ounce of hard liquor. We're not talking about a goblet of wine, or several shots of alcohol in a mixed drink. It's really referring to limited portion sizes. And limiting your red meats, as I mentioned before, as well as your butter, cheeses, and other saturated fats. When we talk about sugar, there were a lot of questions coming through, Dr. Cofino, about the connection between sugar, blood sugar, and hypertension. Can you explain what the connection might be between blood sugar and blood pressure, if any?
Yeah, so high sugar diets tend to affect your cholesterol levels, for one, lead to high triglycerides, and has been associated with a lot of bad physical outcomes, such as one is diabetes, which affects your blood pressure. Second is atherosclerosis, affecting the blood vessels in your body. And we already talked about the blood vessels in the heart. It affects that. So it affects all the vessels, and it affects all the organs that are supplied by these vessels. Now, somebody here actually asked the question, can you reverse atherosclerosis? And I started to type, but I'll just say it here. Caldwell Esselstyn, who did some of the very nice work on the reversal of heart disease, what he's really doing is reversing atherosclerosis. So yes, these diets do that. Now, I'm not saying that if you have got terrible atherosclerosis, you're going to develop the vessels of a 20-year-old. No, you're not. But you can start moving in the right direction. Limiting sugar really helps move you in the right direction.
Yeah, great point. So when you talk about limiting sugar, we're talking about limiting choosing unsweetened versions of packaged foods, and you sweeten it yourself. Avoiding foods with ingredients that have sugar listed in there, so that you're really having the pure food. Using other ways to sweeten your food, such as mashed, crushed fruits, dates, berries, and bananas are particularly good at doing this in your recipes. Caramelizing fruits are also a really great way. When you caramelize something, you're bringing out the sugar, so it makes it taste sweeter. So grilled peaches, sauteed apples, really making things taste even sweeter than they are. Last night for my family, I made a brown fried rice, and I caramelized pineapple before putting it into the dish. And it made it like a very sweet and savory flavor, and enhanced that sweet cravings. Adding cinnamon, vanilla bean, vanilla extract, cocoa powder also all help to enhance sweetness without the addition of a lot of sugar. And when using sweeteners, if you are going to add sugar for things, choose a natural version like honey or maple syrup and use it in very small portions. I see a question about agave. Agave could also work too. Yes, agave could also work too. Oop, a little bit of a snafu there. There we go. And then salts. As we mentioned before, you really want to stick to purchasing things that are low sodium or no salt versions. The goal of what you want to look at on a food label is less than 140 milligrams of sodium per serving. If it's under that number and it has real ingredients that you can understand, it's a good choice for a packaged food, most likely. Instead of seasoning with salt, you want to flavor your foods with fresh herbs, dried herbs and spices, vinegars, wine if you're allowed to have it, citrus, stock, hot peppers or spicy things, cocoa powder, and aromatic vegetables such as onion and garlic all help to give a lot of seasoning and flavor to your food without any addition of salt. And I will say that salt is sort of like alcohol. The more you drink, the more you need, the more salt you use, the more salt you feel you need. It takes a while for your taste buds to adjust. So you need to wean yourself down. If you use a ton of salt in your cooking and all of a sudden you stop using it, the food's going to taste gross. So you want to wean yourself down and gently let your taste buds adjust. And I promise you, after you've done that and gone all the way down to no sodium, as soon as you eat something flavored by a restaurant or with a ton of salt in it, it's going to taste overwhelmingly salty. Same thing with sugar. Same thing with sugar. You got to wean yourself down. All right, so I think we can get cooking. Were there other questions in here, Dr. Cofino? Let me see. Let's see, as a sweetener, I use pure stevia. So you might have heard me before here. I don't recommend artificial sweeteners at all, not even ones that are from a plant, they say. I have read a lot of research that it is not so good for our gut health, and also is confusing to our brains, thinking that it is sweet and actually can increase our sugar cravings. So I'm not a proponent of artificial sweeteners. Dr. Cofino, what do you think about that?
It's interesting because some people have linked it to some kidney problems, hypoglycemia, allergic reactions, GI symptoms, as you mentioned, some endocrine problems. I don't buy into the use of any of the artificial sweeteners.
Yeah.
The goal is not to fool your body. The goal is to shift your lifestyle. It's a paradigm shift of how to take care of yourself. And the question to ask yourself before you cook any of these things is, would I rather take a lot of pills that some doctor gives me, or would I rather live a long, healthy life? All right. And I think that's what's really key. Learn how to get away from the sweetener. Learn how to get away from the salt. You know,
and then if you do eat it and enjoy it occasionally, if you don't have a restricted diet that your doctor has prescribed, it's okay. It's okay to have a piece of cookie or cake or something sweet every now and then, as long as you're not doing it all the time and weaning yourself down to a healthier lifestyle. There's a question in the chat here, Dr. Cofino, about diet sweeteners and stroke connection.
You know something? I've read it, but I can't comment about it. But I have read about that before, and there might be a connection, but I don't know what the data is.
Okay.
Sorry.
No, it's fine. Let's start cooking. I want everyone to see. So we put together a Valentine's Day menu for you, something that maybe you could make for your loved ones this upcoming Valentine's Day. It is a plant-based meal. And it's, as those of you who are asking for quick and easy recipes, it is a quick and easy recipe, promise. All right, so I'm going to tilt my screen down and I'm going to get started here. So this is what I'm going to start with the cherry tomato pasta. So I'm going to start here with some really good olive oil in a hot pan. And I'm going to put that in here with some chopped yellow onion. And some fresh chopped garlic. I'm going to turn my heat down just a little bit so I don't burn myself. And these are the aromatic vegetables we were talking about. Dr. Cofino, I bet you wish you were really in the kitchen with me now.
Yes.
The actual kitchen. Really get a good shot there. There we go. Okay. So I'm going to let that cook just a little bit. Careful not to burn the garlic. That's a very important thing. And while you're cooking this out, it's going to help to infuse the olive oil with the garlic and onion flavor. To this, I'm going to add my fresh chopped cherry tomatoes. And this is a recipe I actually learned when I was making in Italy. So it's a very fast Tuscan dish, and it is a good staple in my house. I'll make this sauce and I'll put it over fish. I'll put it over pasta. I'll put beans in it and serve it that way. It's very versatile. And I love it because, especially in fresh cherry tomato season in the summer, I'll make it in large batches and I'll freeze so that I can pop it out and use it in the winter time. So the tomatoes are really great in this time of year because it's full of immune boosting vitamin C. And I'm gonna let that cook. And when it's cooked down a little bit, you're gonna add the fresh Swiss chard that I've chopped in here. The Swiss chard is one of these superfoods. It's a rich source of iron, of calcium, of vitamin K, you name it, has a ton. And you could use Swiss chard, you could use spinach, you could use whatever dark leafy green you want. And this is gonna cook down. And through the magic of television, I'm gonna show you what it looks like after it's been cooking for a while. It smells amazing. And you notice I didn't use any salt whatsoever, nothing. After that has cooked down, it looks like this. You can see here, this is the sauce and how it cooks down. I'm preparing it with a chickpea pasta. Dr. Cravino, what do you think about the chickpea pastas or other bean-based pastas? Do you recommend them to your patients?
I definitely do. I'm a huge bean person. Deb, my wife, who I think is listening, went out shopping the other day. She asked me, how many cans of garbanzo beans do we have? I said, 6. And so she bought more. So we're huge fans of beans. And you know,
and that's a good point. You mentioned canned beans, perfectly fine when you're buying the low sodium version.
Yeah. That looks so good. Amy, that looks so good.
I wish I could give you some. So you toss that together, and I would say it cooks for about 30 minutes, maybe. And you can make it ahead. And so this is like a really beautiful Valentine's Day meal. I'm going to show you the dessert, of course, but this is how this looks. It's completely plant-based, full of fiber for the bean pastas. Now, in terms of the dessert here, because you can't have Valentine's Day without dessert. Dessert on Valentine's Day is approved by you, Dr. Cravino. What do you think?
It's approved by me.
It's approved on Valentine's Day?
Yes, Amy, you need to save me some of this, please.
Okay. I think I'm making him hungry. So essentially what I did here to make our truffles, this is our chocolate nut butter truffles. What I did here in this bowl is I melted some really, really good dark chocolate. I put semi-sweet in the recipe, but in my house, we did it with dark chocolate. And I melted that in the microwave for about a minute. You could also use a double boil. I mixed it with, I used peanut butter because I wanted to make it taste like chocolate and peanut butter, that beloved candy that we all love, and some yogurt. And then I'm going to show you what we do with the cocoa powder to make them pretty. So after I mix them all together, the melted chocolate, the yogurt, and the nut butter, I put it in the refrigerator, and it forms like a dough here, if you can see how thick the batter is. And essentially what I'm going to do is I'm going to take little bits of it about this size here, and I'm going to roll it. Oh, that part didn't quite set. Let me get a colder part here. There we go. I'm going to roll it in my hands to form truffles. Apparently I can't roll and talk at the same time. So little bite-sized truffles here. And I'm going to take my really good quality cocoa powder. I'm using Dutch cocoa powder. And I'm going to roll them here. And remember what we said, cocoa powder makes everything taste sweeter. So I'm using dark chocolate. If you're not used to dark chocolate, it's going to enhance the sweetness here. And I form my little truffle. And the way I'm going to present it to my loved ones on Valentine's Day is in a heart. Let me see if I can turn it to the camera so it's a real heart shape. There we go. My little truffles. And if you're allergic to nuts, you could do this with sunflower seed butter, with soy nut butter, but little tiny bundles of rich chocolate taste that is really heart healthy, and a perfectly healthy sweet treat. What do you think of my Valentine's Day menu, Dr. Casino?
Oh, I love it.
You can make it for your wife and your children if they're home.
I don't know if you've seen me, but I'm actually taking pictures.
Oh, excellent. Excellent. I'll send you all of the recipes for sure. Let me see. I see some more questions coming through the chat here. Let me make sure that we answer as many of them as we can. All right, Dr. Cofino, are there certain medications like ACE inhibitors or sodium glucose transport inhibitors for chronic kidney disease?
Okay, so there are classes of medications like ACE inhibitors and angiotensin receptor blockers. The ACE inhibitor would be lisinopril or ramipril. The ARB would be losartan, valsartan, any of the tans. They decrease blood flow to the kidney. By decreasing blood flow to the filtering part of the kidney, they lower the pressures there. And in addition, they do other things in the kidney, which are a little outside of the scope of this conversation, and they protect kidneys. You said SGLT2 inhibitor? Wow, amazing. Medications like Farxiga, there are a whole lot of them. They're all brand new. We find that they're cardiac protective. They protect the heart. They protect the kidneys. They lower blood sugars in people with diabetes, and they do come with some slight increased risks. They do affect kidney function slightly, but overall protect them, as the ARBs and ACE inhibitors also do. But they're now starting to be used. They've been very successful, very successful. If you're a diabetic and you have protein in your urine, it's a great medication. If you have kidney disease, it's a great medication. If you have heart failure, it's a great medication. Speak to your doctor.
Excellent, thank you. I see some other questions here asking about recipes. For sure, in this series, we will be featuring a lot of these plant-based recipe ideas. So each month, definitely tune in for that. Are vegetables served raw or cooked? Serving is a cup raw or half cup cooked. You definitely, it depends on the vegetable. The more vegetables, the better, as long as they're not deep fried vegetables. So whether your preference is raw or cooked, doesn't matter, as long as you're getting really generous amount on your plate at every meal. Let's see some other investment into meal kit boxes. Anything that'll get you actually cooking, I say go for it if you can afford it. Would you agree, Dr. Cofino? Are you a fan of the meal kits? Yeah, for sure. He said yes, for those of you. Yes. Do you have a preference for non-fat, low-fat, or whole-fat dairy? I tend to recommend low-fat dairy as opposed to non-fat or whole-fat for two reasons. One, the non-fat, you're without any fat in it whatsoever, unless you're pairing it with, say, like a nut, a peanut butter, like some other source of plant-based fat. Your body needs a little bit of fat to have better absorption of vitamins and minerals. So especially vitamin D, that's fortified in a lot of these milks. Same with calcium, even the research is showing as well. So I recommend low fat, like a 1% or a 2%. Whole fat tends to be too much for most people, from a saturated fat perspective, but also from calories, unless young children are consuming it. So the middle ground, I think, is a nice low fat dairy. Would you recommend with that? Agree with that, Dr. Cofino?
Remember, I'm a vegan. I mean, I'm plant-based.
Yes,
So
true.
I stay away from the animal products. So I'm going to defer to you on this point. But what I will say is that a study came out in New England Journal of Medicine, which everybody knows about. It's the Mediterranean diet study. They talked about if you stick with the Mediterranean diet, it's the low fat dairy products, and they were very clear about that.
Yes, yes. The skim, I tend to say, is it's almost not worth it at times. Could you use tomatoes instead? What could you use instead of tomatoes in the pasta recipe? To create the sauce, there really isn't a substitute. for tomatoes in this one. So really it's the tomatoes for this particular recipe. There are other recipes you could use. You could cook down eggplant to make a great sauce, or mushrooms, but this one you can't really change. What'd you say, Dr. Covino?
Basil.
Basil instead of the tomatoes? It could be good. It could, I think it just changes the sauce completely, this particular recipe. But there are lots of ways, garlic and oil recipes. You could just do a simple one with some broccoli. That would be an excellent choice, or some another type of green vegetable in addition to that. You definitely could do that. Tomatoes kind of turn it into more of a sauce for this one. Oh, a vegan cheese substitute. That's a good question. Do you have a recommendation, Dr. Covino, for what you personally use? I can give some other ideas, but what do you use for a cheese substitute?
There are a couple of substitutes there are a couple of cheeses that they have at Whole Foods and at Mrs. Green's Market. And I don't know the name of them, but in general, I try to stay as close to the ground as possible. The more processed it is, the potentially more problematic it is. So I don't eat a lot of that. I'm not saying I don't cheat sometimes, but I don't eat a lot of that. Okay.
Yes. A good substitute, I'll say it for this recipe, if you're missing that like Parmesan taste, you could add nutritional yeast. Do you ever do that in your cooking at home, Dr. Covino? Nutritional yeast is a substitute for Parmesan.
I unfortunately don't cook a lot these days.
Well, that is a good one if you ever have some time back in your schedule to do that. Substituting nutritional yeast is a great substitute for Parmesan cheese. Okay, we have time for just a couple more questions. I see, first of all, some kudos to you, Dr. Covino, saying you're the best. Himalayan salt instead of regular salt. So I really want to make this clear. It doesn't matter if it's Himalayan salt, pink salt, green salt, blue salt, whatever salt you find, salt is salt, just like sugar is sugar. Okay. So it doesn't matter how fancy the salt is or how much better it tastes. Salt is still salt. So you still want to include them all together. Same with sugar. It could be coconut sugar. It could be white sugar. It could be cane, unrefined sugar. Sugar is sugar. So they all loop together in your restrictions.
So let me just say a quick something about salt. So some salts are listed as lower sodium. Okay, that's a farce. If you have a bigger grain, you take a teaspoon of it, right? It's going to have lower sodium than if you grind it down and put it in the spoon. The spoon will hold more. But the reality is it's still salt. Stay away from it. Everything has salt in it. Every cell, every plant has salt in it automatically. All right?
Yes. And even if it doesn't taste salty, it might have salt in it.
It automatically has salt. You know, God put the salt in it. So adding salt is problematic, no matter how you do it. Stay away from those things. Stay away from all these great tasting salts.
Yes. And I'll add just on one last question here. We have time for, how do you get started on a vegan diet on a budget? I would argue that the vegan diet is one of the most budget-friendly styles of eating, in the sense that you could, animal proteins, dairy are very expensive, especially these days. So canned beans, frozen fruits and vegetables, whole grains, these are all things that are very affordable. And I also often recommend in my community presentations that if budget is an issue for you, having more plant-based meals in your diet actually is more affordable way of eating. You have to do a little bit of digging sometimes to find the deals on frozen and on fresh instead of frozen or canned or those types of choices. But it's definitely a more affordable way of eating. Would you agree with that, Dr. Covino?
Totally.
Yes. All right. Well, thank you everybody for joining us. If we didn't get to your questions, please know there will be a survey that pops up automatically at the end of this presentation. It's 4 short questions. We really would appreciate it if you could fill it out so we can continue to provide these programs. Really, the surveys help us to do that. If you have any further questions, you can put them in there with your name and contact information, and someone will get back to you, as well as if you need a referral for anything. So thank you so much for joining us, Dr. Covino. Thank you for joining me in the kitchen today.
Thank you for having me.
It was wonderful to have you. You're welcome back anytime. And everybody, we wish you a great, wonderful, happy Valentine's Day and a heart healthy month.
Bye-bye.
Take care.